Have you ever found yourself shifting awkwardly in your chair or standing up from the sofa, only to realize, why does my lower back always hurt more on the right side? It's such a common frustration. You start to wonder, did I twist wrong? Is my spine out of alignment? Could it be my kidney or something more serious? The weird part? It often feels totally fine on the left side, like your body decided to dump all the tension and pain into one spot, right over your right hip or right side of your lumbar spine. And if you're like most people, this probably started small. A twinge here, a bit of soreness after a long day. Then, over months or even years, it's turned into the stubborn tightness or low-grade ache that flares up after sitting too long, driving, or doing household chores. You might even catch yourself pressing your hand into that exact spot on your right lower back, trying to massage it out, but it keeps coming back. This is more common than you think. If you've been feeling a bit paranoid that something's wrong with your right side, take a deep breath. Lower back pain that's more pronounced on one side, especially the right, is extremely common. In fact, studies on asymmetrical low back pain show that for most people, the right side tends to dominate. But why? There's some very real reasons. And no, it's not just random. First, your body is not symmetrical. This might sound obvious, but it's the foundation of why your right side is often more beat up. Most people are right-handed and right leg dominant. You carry bags, groceries, kids, and boxes more often with your dominant side. You tend to twist or pivot to that side when you reach or rotate. Even something as innocent as always putting your weight on your right leg, when standing shifts your pelvis over time. Your muscles, ligaments, and even the tiny stabilizers around your spine adapt to these repeated patterns. Over years, the right side gets a little tighter, does more micro work, and starts to show signs of overload. Your daily habits quietly overload one side. Picture your typical day. You probably drive with your right foot constantly pressing pedals, creating subtle rotation. Sit at a desk slightly turned to the right because your mouse or papers are there. Cross your right leg over your left when relaxing on the couch. Sleep on your right side because it just feels better. None of these things are bad in isolation, but after thousands of hours, your body starts to set in that pattern. So your pelvis might be slightly tilted forward or hiked on the right. Your right quadratus lumborum, QL, a deep muscle that helps lift your hip, gets tighter. Your right lumbar paraspinals start working overtime to keep your torso upright. And before long, you feel that nagging, localized pain right on the right side of your lower back. Your brain might be protecting a perceived weak spot. Here's something most people never think about. Your nervous system is constantly scanning for instability or microstresses. If it senses that one side of your spine is working differently, maybe because your hips rotate more that way, or your core engages unevenly, it will tighten the muscles on that side to protect you. So ironically, that tight, sore spot on your right lower back might not be a sign of strength. It's often your brain telling the muscles to lock down to guard a slightly wobbly or overused joint area. It's a protective strategy. Problem is, over time, that constant guarding feels like stiffness and pain. It's usually not your kidney or internal organs. Let's clear up one of the biggest fears right away. Yes, your kidneys sit roughly under your lower ribs, and kidney problems can cause back pain. But kidney pain tends to be higher up under the rib cage and deeper, not right in the lumbar belt line. It usually comes with other symptoms like fever, nausea, changes in urination, pain, burning, blood, or feeling sick overall. Pressing on your back muscles doesn't typically make kidney pain worse. So if your right side lower back pain is mostly triggered by movement, posture, bending, lifting, or sitting too long, it's almost always mechanical, meaning it's related to muscles, fascia, joints, or nerves, not your kidneys. That should already give you some peace of mind. Why it matters to understand this. Most people skip this step. They jump straight to treatments, like stretching, foam rolling, or taking pain meds, without really knowing why their right side is a problem. But if you don't figure out the why, it just keeps coming back. Your brain is still protecting that imbalance. Your dominant side is still doing extra work. Your pelvis is still slightly tilted or rotated. So all you're doing is chasing the pain, not fixing the source. In this video series, here's what you'll learn. In this video, we're going to break down the most common mechanical reasons your right side hurts more than your left. We'll cover the way your pelvis moves, how certain muscles overload, and how your daily patterns feed into it. How to rule out more serious causes, like nerve root compression or kidney issues, so you know when to see a doctor. And most importantly, how to start rebalancing your body with simple checks and movements that show your nervous system it's safe to finally let go of that tension on your right side. Because if your right lower back is always nagging you, it's almost never random. It's your body telling a story about how you move, stand, sit, and stabilize. Once you decode it, you can start teaching it a better story, one without constant right-sided pain. Part 2, the most common reasons your right side hurts more. All right, so now that we've covered in Part 1 how incredibly common it is to have lower back pain that's worse on just one side, let's get into the most important question of all. Why is your right side the side that always hurts more? Most people expect it must be something scary like a nerve pinched only on that side, or even a kidney issue lurking on the right. And while sure, there are rare cases where that's true, we'll get into red flags later. The truth is that for the vast majority of people, the reason your lower back pain shows up more on the right is actually a predictable combination of your daily habits, your natural body asymmetries, and simple muscular overload. Let's break this down into everyday, real-world causes you can easily see in yourself. 1. Dominance and one-sided overuse. Here's the first huge clue. Most people are right-handed and right-legged dominant. Think about it. When you carry your grocery bags, briefcase, or backpack by hand, which hand usually does it? When you go upstairs, which leg steps first most of the time? When you kick something on the ground, which foot do you instinctively use? It's almost always the right side. That means your right leg and right lower back muscles are consistently doing more stabilizing, more pushing, and more bracing than your left. Over days, weeks, and months, this builds up an imbalance. It's like always driving your car with slightly more weight on one side. The tires wear unevenly. Your body does the same. Muscles on your right lower back, like the quadratus lumborum and parts of the erector spinae, work harder, tighten up more, and develop small trigger points faster. 2. Subtle pelvic tilts and rotations, usually more on the right. Here's something most people never think about. Your pelvis is rarely perfectly level. Most people have a slight natural asymmetry. One side of the pelvis may be tilted slightly higher, called a pelvic obliquity, or rotated slightly forward, anterior rotation, compared to the other. Studies on thousands of people show a slight anterior tilt on the right side is surprisingly common, especially in people who are right leg dominant. Why? Because that's the leg you typically push off from when walking or standing up. So over years, it slightly tugs the pelvis forward on that side. Now here's the kicker. When your pelvis tips or twists just a little on the right, it changes the angle of your lumbar spine above it. Your right-sided back muscles must adjust to keep you upright, so they tighten and work over time. Over time, that becomes your normal, and it sets up chronic mild compression and tightness on the right side. 3. Repetitive patterns, driving and working posture. Think about how you sit while driving. Your right foot is constantly on and off the pedals, meaning it's slightly ahead of your left foot. Your right hip is often slightly flexed while the left is more relaxed. Even your torso might lean subtly to the left to compensate. Or think about your work chair. Do you sit slightly twisted to reach for your mouse on the right side all day? Or always cross your right leg over your left when you sit back? Maybe when you talk on the phone or read something, you tend to lean more on the right elbow rest. Each of these small things doesn't seem like a big deal, but over years, they add up, training your body into a slight torque. Your right lumbar spine starts to carry more rotation and lateral load. This sets up an environment where your right side lower back is simply overworked, constantly micro-bracing to keep you stable. The result? Chronic tightness, easier muscle fatigue, and often more soreness on that side. For the infamous quadratus lumborum, QL, overload on the right. Let's get specific with one of the biggest culprits, your quadratus lumborum muscle, or QL for short. This muscle runs from the top of your pelvis to your lowest rib, with fibers connecting to your lumbar vertebrae. It acts like a powerful guide wire, stabilizing your spine side to side. It also helps lift your hip or bend your torso sideways. Because of all the daily right-sided dominance we talked about, the QL on your right often gets tighter and thicker from overuse, develops trigger points, small knotted areas that refer pain down into your butt or even around your abdomen, becomes more reactive to simple movements like bending or twisting. This is why so many people say, when I press into the right side of my low back, it feels super tender. The left side, barely anything. It's often your QL telling you, hey, I've been holding you up extra for years. 5. Minor spinal joint compression, facet joints on the right side. Now, let's not forget your facet joints, those small joints on the back of your spine that guide and limit motion. When your pelvis and lower spine are slightly rotated or tilted because of habitual patterns, like driving, always leaning to the right of your desk or crossing legs, it can cause the small joints on your right side to bear more load. This isn't usually a dramatic pinching, but even mild extra compression means the joint capsule can get slightly inflamed over time. It sends signals up to your brain saying, I feel unstable here, which then recruits more muscular tightness around it to protect. This is why one-sided pain often feels deep and achy rather than sharp and nerve-like. So putting it together, it's your everyday life stacking up. If you take all of this, dominance on your right leg and arm, driving, carrying bags, pivoting, climbing stairs, a slight pelvic rotation or tilt that often favors the right, repetitive postures at work, and in the car that subtly load the right side more, a QL that's thicker, tighter, and peppered with trigger points, small facet joints that get slightly compressed on that side. It's no wonder your right lower back is the first area to complain. Your body is simply following the path of least resistance. It overloads the right side because that's where it's being asked to stabilize you every single day. But good news, this is mechanical, which means it's fixable. Unlike scary neurological problems or diseases that require surgery, most right side lower back pain is purely mechanical. It's your muscles, joints, and movement patterns adapting to how you use your body every day. And that means with the right approach, learning to balance your hips, activate underused stabilizers, and give your right side some much-needed relief, you can dramatically reduce this imbalance. Coming up next in Part 3. In the next part of this series, we'll dive into the few cases where right side lower back pain does point to something more serious, plus simple home tests you can do right now to figure out if your pain is purely muscular and mechanical or if it's something that needs a professional's eyes. Because most of the time, your right lower back is just telling you, I'm carrying more than my fair share. But we also want to be smart and rule out anything more urgent. So stay tuned. You'll learn how to tell the difference, plus what signals should send you to a doctor right away. Part 3. When right side lower back pain is more serious, and simple tests to figure out. Alright, so by now you've learned that for most people, lower back pain that's worse on the right side is mechanical. It's caused by your daily habits, your dominant side doing extra work, tiny pelvic shifts, or muscles like your right QL and paraspinals constantly protecting you. The best part? That means it's usually fixable through better movement patterns, gentle strengthening, and restoring balance. But here's the truth. Not every case of right-sided back pain is innocent. Sometimes one-sided lower back pain can be a sign of something that needs medical attention, like nerve compression, kidney involvement, or a more serious spinal joint problem. So, in this part of the video, we're going to go through when your right side back pain might mean something more. Simple at home checks to tell the difference. And what symptoms are big red flags telling you to see a doctor? Because being proactive is key. Most cases are simple, but ignoring the wrong warning sign can set you up for bigger problems. When it's not just muscles and joints. Let's start with the less common, but more serious possibilities. They're rare, but important to rule out. 1. Nerve involvement, sciatica, or nerve root compression. Sometimes your right side lower back pain isn't just tight muscles or joints. It's actually your lumbar nerve roots being irritated or compressed, often from a disc issue. Here's how you might recognize it. Pain that travels. Instead of staying most on the lower back, the pain radiates down into your right buttock, thigh, or even below the knee. It might feel like burning, electric zaps, pins and needles, or a deep toothache kind of pain, numbness or tingling. If you sometimes feel your right leg or foot going numb, or you notice pins and needles along the side or back of your leg. Weakness. If your right leg feels weaker when you stand on tiptoes or try to lift your foot. A common culprit here is a lumbar disc bulge pressing slightly on the nerve root exiting on the right side, or sometimes narrowing in the little foramen hole where the nerve exits. 2. Kidney referral, though less likely. Because your kidneys sit roughly under your lower ribs, they can refer pain around to the side and even the back. But kidney pain is almost always higher up, closer to the rib cage, not right at the belt line. Deep and constant, not changing much with movement or pressing. Often comes with other signs like fever, nausea, or burning with urination. If your right side back pain is worse when you press on your muscles or when you move, twist, or bend, it's nearly always mechanical. But if it's deep, unchanging, and you feel sick overall, check in with a doctor. 3. Sacroiliac joint inflammation. Another less common but real issue is your right sacroiliac joint, SI joint. Acting up, your SI joint connects your pelvis to your sacrum at the base of your spine. It can get inflamed from falls, repeated uneven loading, or postpartum changes in women. Signs it's more SI related. The pain is very low, almost near the butt cheek. It gets worse if you stand on one leg or step upstairs. Pressing just to the right of your tailbone might be extremely tender. Simple self-checks you can do at home. Now, let's give you a few easy self-assessments so you can figure out if your pain is more likely to be mechanical muscle/joint tension versus something involving nerves. Test 1. The movement change test. Stand up tall. Take note of how your right lower back feels. Slowly bend forward, then backward, then side to side toward right and left. If your pain changes, meaning it gets worse in one direction but feels better or neutral in others, it's almost always mechanical. That's good news. It means your muscles and joints are just tight or overloaded, not nerve compromised. If it's nerve related, you're more likely to feel sharp, shooting pain down the leg, especially when bending forward, or a weird combination of pain plus tingling that doesn't go away with position changes. Test 2. The seated slump plus foot lift. This is a super gentle check for nerve tension. Sit on a chair. Slouch forward a bit with hands behind your back. Slowly straighten your right knee to lift your foot. If you feel a stretch or tension in the back of your thigh or calf, that's normal. But if it feels like burning, zapping, or increases your usual back pain sharply, it could be slight sciatic nerve irritation. Don't panic. Most mild cases settle with conservative care, but it means your nerves are a little sensitive. Test 3. Palpation trigger test. Use your thumbs to gently press along the muscles on your right lower back, about 2 inches to the side of your spine, from the top of your pelvis up to your lower ribs. If you find tender, knotty spots that reproduce your usual pain, that's actually reassuring. It means it's likely your muscles or fascia-generating problem, not your nerve roots or kidneys. The true red flags, don't wait if you see these. Most right-sided back pain is mechanical, but if you ever experience numbness or weakness that's getting progressively worse, especially in your right leg or foot, changes in bladder or bowel control, trouble starting, leaking, or not knowing when you're going, severe, constant pain that doesn't change with positions, especially if it's accompanied by fever, chills, or unexplained weight loss, stop watching YouTube and call your doctor. These are rare, but they are real red flags. Wrapping up, most cases are mechanical, and that's good. The vast majority of right-sided lower back pain isn't your kidneys. It's not cancer. It's not even necessarily a major disc herniation. It's your daily patterns. Slight pelvic shifts, overloaded right side stabilizers, tiny compensation from sitting, driving, or always using the same side. That means you can fix it. In the next part of this video, we're going to put all together with a simple, daily approach to actually rebalance your body so your right lower back doesn't have to keep overprotecting and tightening. You'll get a short, no-equipment routine that restores hip symmetry, wakes up your core, and teaches your nervous system that it's safe to finally stop gripping on that side. Because this isn't just about short-term relief. It's about training your body out of the habits that cause your right side pain in the first place. So stick with us. The fix is simpler than you might think. Part 4. How to finally fix right side lower back pain. A simple daily blueprint. All right. You've stuck with me through the science, the daily habits, the hidden muscular overload, and even the tests to rule out serious issues. By now, you probably see your right side lower back pain totally differently. It's not just bad luck or something random. It's your body adapting to how you've moved, stood, sat, and compensated, probably for years. And here's the best news. Because it's mechanical, it means you can actively change it. You can teach your body new patterns that finally take the extra stress off your right lower back. So in this final part, I'll give you a simple daily blueprint that takes just a few minutes, requires no fancy equipment, and will finally start to retrain your system to balance your pelvis, take pressure off your right side, and teach your brain it doesn't have to keep locking up those right-sided muscles. 1. Rehydrate your discs and start your morning right. We've said it before, but it's so important it deserves its own step. When you wake up in the morning, your discs are more hydrated, which makes them temporarily more vulnerable. If you roll right out of bed, bend forward to tie shoes on the floor, or do a deep forward fold to stretch out, you're pressing extra fluid backward into your disc walls. Over years, that small daily habit alone can set up micro tears in guarding. Morning reset. When you wake up, roll to your side first. Push yourself up with your arms instead of curling your torso. Stand up, move around upright for first 15 to 20 minutes. Drink a big glass of water to start rehydrating your tissues. Your right-sided muscles will be less likely to tighten if they're not constantly reacting to little disc bulges. 2. Train your hips to take the load. One of the biggest reasons your right lower back stays tight is your pelvis being slightly rotated or your hips being sticky. When your hips don't move well, your lower back twists and bends too much to compensate. That overloads your right side stabilizers. So we fix it by teaching your hips to move instead of your lower back. Micro hip hinge daily habit. Stand with feet hip width, knees slightly bent. Put your hands on your hips. Push your butt back slightly, like closing a car door with it, keeping your spine neutral. Squeeze your glutes to come back up. Do 10 reps slowly, at least once or twice a day. You can even do this while brushing your teeth. This pattern trains your body to bend at the hips, sparing your lower back. Lunge reaches for pelvic balance. This helps gently open up the right front hip that's often tighter and pulling your pelvis forward. Step your left foot forward into a small lunge. Keep your torso upright. Squeeze your right glute. Reach both arms up overhead. Maybe lean slightly to the left. Hold for 20 seconds. Switch sides. Repeat twice. Over time, this levels out subtle pelvic rotations that feed right side overload. 3. Calm your nervous system's guarding with gentle stability. Remember, tightness on the right is often your brain protecting because it senses things are unstable. Instead of stretching, we want to gently turn on your deep stabilizers so your brain feels safe to let go. Diaphragmatic brace breath. Sit or stand tall, hand on your belly. Inhale through your nose, let belly and sides expand. Exhale slowly through pursed lips. Gently pull belly in. Feel a light tension wrap around your spine. Do this for 5 slow breaths, multiple times per day. It's low-key, subtle, but tells your nervous system, we're supported. You can stop gripping. Glute squeeze resets. Stand tall. Squeeze your butt muscles together as hard as possible for 5 seconds. Then relax. Do 5 to 6 reps. This is critical because weak or sleepy glutes mean your right lower back takes on too much stabilizing. For release tight points, but the smart way, instead of aggressive twisting or pulling your lower back into stretches, you can gently reduce overactivity in the tight right side muscles by using myofascial pressure. Tennis ball or massage ball QO release. Lie on your back with knees bent. Place a tennis ball under the right side of your lower back, about 2 inches out from your spine, near the bottom of your ribs. Slowly let your weight sink in. Breathe slowly. If it's tender, back off slightly. Hold for 30 to 60 seconds. Then move slightly to another spot. Do this 1 to 2 minutes total. Then get up and walk around to reset the pattern. It calms the tight trigger points that often keep the right side locked. 5. Decompress before bed for overnight recovery. Your spine decompresses most overnight. So ending the day with gentle unload helps your right side not brace up as much during sleep. 90 to 90 decompression rest. Lie on your back near a couch or chair. Place your calves on the seat so your hips and knees are both at 90 degrees. Let your arms rest out to the sides. Breathe into your belly slowly. Stay here for 3 to 5 minutes, letting your lower back relax. This unloads the discs, calms your spinal nerves, and resets tension before sleep. Putting it all together, your right side anti-tightness blueprint. Morning, roll out of bed carefully. Big glass of water. Stay upright 15 minutes. Midday, 10 micro hip hinges. 2 to 3 lunge reaches each side. Diaphragmatic brace breaths. Afternoon or after work. Stand up hourly. Squeeze glutes. If seated long, do another set of hip hinges. Evening, tennis ball release on right QL. 90 to 90 decompression for 5 minutes before bed. Why this actually works, unlike stretching. Because instead of just chasing symptoms by pulling on tight muscles, you're fundamentally changing the inputs your nervous system gets. You're hydrating your discs. You're teaching your hips to move, so your right lower back doesn't have to. You're activating deep core and glutes, so your brain stops commanding those right lumbar muscles to lock up, and you're giving your right-sided fascia and joints a break from constant compression. That's how tightness goes away, not by forcing it, but by making your system feel stable and safe. So here's what I want you to do. Try this blueprint for just 1 week. Then drop a comment below. After 7 days, here's how my right side feels. If this video gave you even one aha about your lower back, smash that like button. Subscribe, because next we'll break down the worst seated habits that are secretly twisting your spine and how a tiny chair adjustment can fix it. Your right side has been doing extra duty for years. It's time to finally give it a break and build a body that moves balanced, strong, and pain-free.